Okay, before it was not good, if I may say.
Yeah.
And you would go to the hospital. I don't know the mentality with the service providers. They have improved now.
Yeah.
Because they are like they have gotten the message from us and from other organizations which have been supporting us in doing the advocacy of persons with disability, women with disability. So from that, they have improved. The service providers have the awareness that we have persons with disability, and these persons with disability need the same service just as the other persons without disability.
Yeah. I think when we had a report on the challenges that these people were facing, we asked for a meeting with the Department of Health. Yeah. That is in the year 2023 with the chief officer then, who convened a meeting with other hospital personnel, like the social workers, people who are in charge of the people with disability, the Department of Gender. We sat down and we discussed these issues together. On the county government, we didn't face a lot of challenges on bringing this issue to them. We also did a visit to the county assembly to advocate, because there is a committee that deals with gender issues with disability. Yeah. We did a petition to them also to fast track the issues. Makueni, we are not bubbly off when it comes to public participation. It's a listening government.
So one of the few things that happened, we did a quick assessment on where our facilities were located and also the distance that is recommended from one facility to another, where WHO recommends 5 kilometers distance from one facility to the other. So once we mapped up that, now we identified locations where we need to set our facilities. So we increased the number of facilities, where we currently have 242 facilities across the county, and that has significantly reduced the distance to approximately 4.5 kilometers distance from one facility to the other. So that sorted out the aspect of accessibility. And now the other bits that is also going around is also trying to improve the road infrastructure component. Where now, once the accessibility is also addressed, now the aspect of access through the vehicles or the means of transport that is going to be utilized is also sorted out. So some of the few services that we have been keen on, and especially for the people living with disability, we have some of the healthcare workers, 6 of them who benefited from sign language, which was not something that was very common for healthcare facilities to do. So we were fortunate enough to train 6 healthcare workers on sign language, and that has been tremendous to support that population. And then also we introduced the access of our buildings in regards to ensuring that majority of our buildings have ramps that can be accessible with wheelchairs for patients who will be wheeled, or even trolleys for patients who need to be wheeled into the hospitals using stretchers or using wheelchairs. So those are some of the other infrastructural issues that we have addressed using the same infrastructure aspect, focusing on PWDs.
In a country where women are too often silenced by systems, by stigma, by distance, Makueni is showing what happens when you start by listening.
So people-centered is the listening first, and then acting after listening. So us is first listening to what are the needs of our community. How do they feel that they are offered services in the right way? Once we listen, then how do we replicate that and action it to be actionable, in the sense of that they will actually feel that the services we are provided align to their needs, and also us aligning to meet the needs of the population that we are serving.
What if every county in Kenya listened like this? What if no woman had to scream or suffer just to be seen? What if care everywhere began with dignity? When the system listens, it heals more than just the body. It restores trust, it restores hope, and sometimes it restores life itself.